Hey there, it's Dr. Brian McKay, not just a chiropractor for Stamford, Darien, Norwalk, New Canaan. Well, what we're going to talk about today is Shockwave Therapy as a way to treat musculoskeletal pain. Now, there's so many different things you could do. You could take Advil, Aleve, ice, rest, massage, chiropractic, PT. But let's just take a chronically bad low back. We happen to see a lot of it around here. So what happens is you're going to have muscles that are just not able to provide the movement that it should move or support for the musculoskeletal system. So you have musculoskeletal derived lower back pain. Well, of course, you come in to see me. We're going to do the chiropractic adjustment to reposition the vertebra. We'll probably do decompression if the disc is involved. We're going to do some work on the nerves. Um, but what happens is sometimes the muscles just aren't responding. So I want you to think about the last time you're sitting at your desk, someone comes over and he puts a really deep rub into your shoulders. What you're feeling there is that lactic acid. Okay, lactic acid pulls in the muscles. And the reason you have more lactic acid in the muscles that are injured is because the muscles require more glycogen, which is muscle fuel. So glycogen is a sugar, is converted in the body, and what happens then is it pulls in the belly of the muscle. So the muscle becomes groggy, stuck. You can't get the lead out. So the shockwave therapy is a very valid way to eliminate or to force out the buildup of lactic acid. So think of it this way, and instead of having scar tissue, say you got a bad low back and it's chronic, you're going to have disorganization of the tissue in that area. The muscle tissue is not cohesive as it would be in like a 16-year-old athlete's lower back muscle. You say you're 39 years old. So in this case here, this normal cause of micro scar tissue is probably a good way to look at it. So you have this micro scar tissue that develops because the muscles are working harder over a period of time because the area is not stable. So this analogy I try to use with many patients. Hopefully you'll get it. You have five people doing a job. Three people show up. Two people call in sick that night. The work still has to get done. The other three people have to work harder. So in this case here, when you have a musculoskeletal issue, say a bad low back because the vertebra is shifted out of place. It's chiropractic, we call it a subluxation. Whatever you call it, I'm happy with whatever you want to call it. But when the bone is out of place, now the muscles that attach to that bone have to work harder. And that is where we use shockwave therapy to get those muscles to release. Okay. And here's how it works. The shock wave creates angiogenesis, which is increased blood flow. So you're getting more blood flow to an area. So now you're not only going to have to get rid of the lactic acid buildup, but you're also going to have dead cells you got to get out of there. So it's like taking the garbage out of you. You live in a house, you get a dumpster, and you throw out all your old garbage. How good it feels. Well, I wouldn't say it feels as good to get the shockwave there because there's a little bit of discomfort, but it's not much, and it's only short lived. You may have some redness in the area, but it's very very safe with also very few side effects. Um, Bad news I'm going to add is it's not covered by insurance because insurance companies don't really recognize that something for many years until it becomes tried and true. But anyhow, so you get the garbage out. Um, Stimulates the blood flow to the area because you got to think about when the area is all swollen, and even if it's swelling, how are you going to feel a swollen low back? You're really not going to. You're going to feel pain and inflammation. But anytime there's inflammation, there's swelling. Okay, so pain and inflammation go hand in hand. So what will happen is we'll get the cells to start growing again because now you're going to get more blood flow to the area. So the new cells come in, and the old cells, the dead cells, leave. So that's basically the premise of how the shock wave works. Okay, so it increases nitric oxide production, which is a vasodilator. So it opens up the blood vessels. It creates angiogenesis, creates more blood vessels. You're allowing more blood flow to heal and getting the old stuff out. So it's a very good tool among other tools that can help you have to get over a painful injury or a chronic injury or a chronic illness, like a low bed, a chronically bad low back. Now, here's the thing: is once you get out of pain, or say it's that impediment to you getting better. Now, sometimes you got to do physical therapy afterwards, or commit yourself to a regular exercise program to prevent it from happening again. So it's not just, I mean, try to be aware. If it gets you out of pain and you go back doing the same things you were doing, chances are the problem's going to come back. So for that much, I really think you should probably think about a long term approach to to fixing the problem. Getting out of pain is people's motivation. Insurance companies kind of stop paying, um, after you're out of pain. It's only for emergency care anyhow. Something long term. No, they want you to dig into your own pocket. But here's a couple of things you got to think about with knee pain. You can have patellar tendonitis. That is, this is superior patella, inferior patella. This can get treated with shockwave, and that dissolves some of the crystals that form, the calcium crystals that form in tendons and become stodgy and they don't move as well. A couple of the things is like tennis elbow is a huge one. It's a very big one. So you work tennis elbow, and you should see a big improvement. And actually, tennis elbow is one of those ones that does heal faster than the more chronic issues. Golfer's elbow is the same thing. Golfer's elbow is called medial epicondylitis. Tennis elbow is lateral epicondylitis. Um, if you have tears, okay, say about partial thickness tear, and you don't want to do surgery. Say your rotator cuff is it's not good. Well, the increased blood flow might be enough to help you avoid surgery. So that's not a bad, not a bad thing to have there. And of course we're going to muscle spasms. You have chronically tight traps. Well, traps, the shockwave therapy will break up these adhesions. That's something actually I didn't go over is the formation of adhesions. What I was referring to earlier in this podcast was adhesions. Now, adhesions are that disorganized tissue growth. So instead of like if you just take your fingers and you spread them and you try to bring your fingers apart and then pull them apart, there's a nice smooth fashion. But now if you just jumble all your fingers together, when you have a chronic injury, that's what the muscles tend to look like. So it's disorganized tissue repair and regeneration. And so if you break up that scar tissue or adhesions like is a type of scar tissue, but not as severe. So if you break that up and then the new cells come in, you can get a better healing response. So there's a lot of things. There's a lot of ways to do it. Again, the discomfort part, it's what you have to deal with. I mean, yeah, it's uncomfortable, but the results can be really shocking, and that's the big part. Chronically bad knees, you have to work the muscles, say the rectus femoris, which goes from your hip all the way down to the top of the patella, vastus medialis, lateralis, the obturator, pes serine, popliteus. All of these muscles, when you have knee issues, will benefit from shockwave therapy. So I guess the big question is, why is insurance not covering it? It takes a while. Does it work? Yes. You want to try it out. If you just do one or two treatments, it's probably not going to do much, but you don't need a lot of it either. I mean, if you have, like once a week over, a 6 to 8 week period, should have enough improvement that other therapies will become more effective. So if you look at shockwave therapy as an adjunct, not as a sole form of treatment, I think you benefit tremendously from it if you have chronic issues that are just not responding. So that's my basic talk about shockwave therapy. I hope you found it interesting. If you have any questions, you can reach out. Core Health Darien is located at 551 Post Road, Darien, Connecticut. You can give us a call, 203-656-3636. 203-656-3636. Dr. Brian McKay, thanks very much. Have a wonderful day. Oh, happy St. Patrick's Day. All right, take care.